Hi, guys. Welcome to another episode of Jamaica Politics Uncovered. Guys, there was just a technical difficulty that I had to restart. So I apologize for that. Please make sure that you are liking the live when you come on. Tell somebody that we're back on and let's get started. Tonight, we're here to talk about the truth about the state of Jamaica's healthcare system 2024. We're going to go a little bit into the history of it, and then we will build up and see where we are today with our healthcare system. We're going to also look at some data and compare to other places. So we're back. Make sure that you are tagging somebody and telling them that we are back. The phone lines over here are open tonight. So once we are ready to take calls, you should be able to call in and speak about the topic at hand. So let me see what is going on here. On the screen here, you're looking at the KPH, the Kingston Public Hospital. And because it is the oldest hospital, in Jamaica, been around for about 248 years. We celebrated 240 years in 2016. So it's been around for some time. So I'll give you guys a few minutes to help me share the live to tell people that we are back on so that we can get talking, okay? Thank you for coming back. Sometimes we have a little technical difficulty. Can't control it more time, but that's okay. So let me just do that real quick and then we can get talking. Let's see. So, how are you guys doing? I hope you all had a good day today. We're not talking no more about this election on a live program, guys. We're done with that. I told you what all you needed to know the other night. I made a few video uploads today to kind of give you an idea of what the journalists and the pundits are saying in the country, what the prime minister and everybody said after the EOJ completed their count and told the country what the results are. So go ahead and share the live for me so that we can get started, guys. Please and thank you. All right. So, hi, guys. Welcome, welcome. Miss Sonia, thank you so much for letting me know what was happening earlier. And for those of you who are new to the platform, welcome. Make sure you're subscribed. Those of you who are returning, welcome back. And make sure that you are liking the live, sharing the information, sharing the content. Make sure that when the phone lines are open tonight, don't be afraid to call in. Don't be afraid to, make your contribution and how you feel about what we're going to discuss here tonight. Very important topic, guys. And we're just going to speak honest and frank as we usually do. And as we said, I'm going to go into it historically and then build up to where we are right now, right? Because healthcare is always a topic of discussion in Jamaica, and it should be, just as it is in the United States and other places where, people want reform or there's some kind of controversy. So I'm going to share that with you, show you the data, and so on and so forth. So let me see. The phone number is right there. And for that phone number, guys, it's just for this program, right? So feel free to call in when the phone line is open. It's on WhatsApp. So It won't cost you anything to call. All right, so let's get started, guys. Let's see. Hold on just a second. All right. So, as I said, for those of you who are just joining, we were supposed to talk about the state and status of the healthcare system in Jamaica for about a week now, but because of the election, we had to postpone it. But here we are. So, let us look at the state of the healthcare system and the truth about it. I kind of put a focus on KPH because KPH, like I said, is one of the oldest hospitals in Jamaica, and it is 248 or so years old. And KPH does everything, from various diagnostic, surgical procedures, them the mental health stuff. KPH has been a teaching hospital. I mean, you have seen, people who are in medical school as far as India come to KPH to do their residency. So KPH is one of the oldest, not just in Jamaica, but also in the region. And they have a history. But guys, where we are today with KPH and our healthcare system in general, we have to remember that when KPH was first around, we had a much smaller population. And that would mean that it was a little more different to control. You had a different dynamic going on. Now today, with a population of about 3 million people, you have, the status of people's health changed over time. There might be a problem with obesity, there might be a problem with particular diseases that you're dealing with right now. So you would need a different set of dynamic to manage the problems of today. And when you are in a country where the population has grown, clearly you have to make sure that you have more healthcare resources for the people, right? So as I said, KPH is 248 or so years old. And let us talk about the status of Jamaica's healthcare system where the statistics are concerned. So I drew some stats from different sources. And one of them here, it tells you that for the best healthcare in the world, you have Singapore at one, you have Japan, South Korea, Taiwan, China, Israel, and so on. And then if you look at number 67, that is where Jamaica is. Trinidad and Tobago is about number 64. And then you have the United States at 69. So when you look at a country as the US that we would call a developed country, and you compare it to Jamaica that is a developing country, and to see that they're so close, what does that say to you? You can tell us in the comment section because I'm going to be reading them. And I was looking at something else that's also interesting here, where we talk about performance, right? We talk about a healthcare system performance. It says the top performing countries overall are Norway, Netherlands, and Australia, which to me are no surprises. The United States ranked last overall, despite spending far more of its gross domestic product on healthcare. The US ranks last on access to care, administrative efficiency, equity, and healthcare outcomes, but second on measures of care process. So when we look at that now, see, there are several aspects to healthcare. When we look at access to care, administrative efficiency, equity, and healthcare outcome, them something that them all have them different challenges, right? But when we're talking about the quality of care, where healthcare is working, that is not a problem. It says, care process seem to be fine for the US. So make we look at Jamaica, because what really drives healthcare, whether in a positive direction or negative, is how much a country spends on healthcare plus the functions of the healthcare system, such as the access and the efficiency and the equity and all these things, right? But before I give you information on that, let me just see what you guys are saying here in the comments. Let's see. Yes, so thank you guys for joining or rejoining. We had a little technical difficulty and had to restart, but that's okay. So, good night, my truthful lady. Will Liz be on tonight? I can call Liz. Liz is always willing to come and speak. Liz work over here, She working over here, but I think that she jerking. So, Liz is always on call. She's our on-call correspondent. So when time we call her, she have to come. All right. I'm still having trouble with seeing the live chat. Don't know if anyone else is. No, no problem here. I don't know. Where's the blueprint that's Singapore? Well, on there. Somebody please answer Sonia. Please. If we're not having a problem, answer her and tell her so she'll know if it's her device. Where is the blueprint that Singapore got from Jamaica and why didn't Jamaica implement it? Lona, that is a whole nother topic, my love, and that one there, I gonna require a whole program because it's really embarrassing when you think about it. I have not had too much experience with the Jamaica healthcare system, but I have friends who have had a bad experience. Um, Good night. I was wondering why no sound. Yeah, man, we come off and come back on. Medea still. Thank you for being back. Thank you for being back. Good night. Hope you're having a great weekend thus far, despite the rains. Yes, my friend. Thank you. Same to you. It's been weird with the weather here, but so far so good. And as I said, the phone line is open, guys. So we're gonna take some calls tonight. Remember, successive governments neglected maintaining hospitals and other amenities. It's only now this government is upgrading hospitals and healthcare centers. We're going to get into all of that. And what you just said, Geneva, is so true because, like I said, as our population increases and as medical cares and services, change over time, we have to keep up with the pace of the changes. You understand? What worked for us and was efficient for us in 1902 are got different from today. So we have to always be on top of things. Always make sure so our equipment they are intact. Always make sure that we're expanding to accommodate. Every time you hear the matter about bed space, we need more hospitals. If you put 100 bed in there, can it serve the population? I don't know. We need to do the surveys and do the studies on, what we need as a country, to manage, for healthcare to manage the population. All good and clear, Sonia. Okay, thank you for responding. Sonia, I have, and it's bad before 2016. Where is the number to call? The number to call is right here, and I'm gonna put it up again once the phone line is open, okay? Make sure you add the number to your WhatsApp, guys. And as I said, we are open a WhatsApp group tonight. So all of who interested and over here, if you don't want to come in at the WhatsApp group, then we can do that. All right. But I'm gonna move it from the screen for right now. Or do I need to? I don't know. Yes, so with our healthcare system, when you say that you've had trouble with our healthcare system, you have to tell us in the comments what exactly did you have trouble with? Was it overcrowded? Was it long waits? Was it not having a bed? Was it not getting a prescription? What exactly do you were you misdiagnosed? Which I don't think that's a general problem in Jamaica, because even in first world countries you can get misdiagnosed. It's a malpractice thing. But what exactly do you have trouble with? I remember my experience with the Jamaica healthcare system. I remember growing up in Jamaica, we had more clinics, as I did tell you before, so we had more community clinics. And I am the first child out of several from my parents. So when my mom used to take the siblings to their doctor's appointment and stuff like that, I mostly clinic we used to go. And we had easy access to clinic. The only thing is we used to wait a long time. So like when my mother said she had carried the baby go for immunization at the clinic, we have to plan to spend a whole day, you know, like that. And then with hospital, um, I remember a family member of mine hospitalized, and the hospital was fairly nice. I just never liked the smell of our hospitals. I don't know why, but besides that, I really haven't had a negative experience, personally speaking. One time, I want to say 2012, I thought I was having a medical emergency. But when I got to the hospital and my vital signs were checked, I was fine. That took place in about 20 minutes or so. Yeah. So, me can't speak for everybody though, but it's a talk about my experience. Right. So, let's see. This is why we need to participate in the political process and the census. We don't participate and then demand services from the government. Absolutely correct. I remember back in the 70s, the Port Maria Hospital had private wards. Can this be, I think your thing cut off there. The whole day at the clinic, yeah. All right, so let me just tell you now where we are right now in Jamaica. Um, it is 8 a.m. in the morning, and this is from the Pan American Health Organization. And you know that these guys, they do a lot of studies about not just Jamaica's healthcare system, but across the world. And they look at statistics, data, and they come up with, their findings. So it's 8 o'clock in the morning, and a long line has formed down the outside of the Senan Bay Health Center. That's what you're looking at here. A long group huddled against the wall to catch the fast disappearing shade. Everyone has something in common. They all have diabetes. And that's something that, in my view, it has increased over time in Jamaica. We know this because it's Wednesday, one of the only 2 days per month that doctors are available to see clients with diabetes. Everyone settles in. They know it's going to be a long, hot day. The rise of non communicable diseases in Jamaica has meant a dramatic rise in the number of people seeking assistance from regional health centers and hospitals. Non-communicable diseases such as cardiovascular diseases, diabetes, and chronic lower respiratory disease are the leading cause of death and continue to be a major public health burden in Jamaica due to the lifelong treatment and care needed to address these chronic diseases and conditions. In Jamaica, 70% of all deaths are due to one of the four major non communicable diseases: cancer, lung disease, diabetes, and heart disease. While many more will continue to live with this lifelong disability due to the complications as a result, requiring regular contact with health centers. Health centers face multiple challenges, guys. such as lack of personnel, inadequate infrastructure, and outdated information system, which have led to reduced quality of care, especially for those with chronic conditions. The rise in these non communicable diseases has forced a redesign in how health facilities are built, staffed, and communicate with citizens and between healthcare centers and hospitals. So remember, whole heap of issues that from the system, medical records and how they're kept. I don't even think we have a digital system. I think we still have what they call dockets, right? We are write down and put away in a file and them something there. So the PAHO, Pan American Health Organization, they're assisting the Ministry of Health today in creating a new integrated model of care where the person is central, sorry, to the design and operation of the health system. Developed more than 2 decades ago, the chronic care model is a widely adopted approach to improving ambulatory care that has guided clinical quality initiatives around the world. Jamaica has established a healthcare system strengthening project with an investment of 100 million US dollars over 5 years, which aims to increase the capacity of selected health centers and hospitals to provide comprehensive health promotion, disease prevention, and treatment to meet the specific needs of individuals in the community through tailored infrastructure upgrades to facilities, linked information systems, and developing standardized care or levels of care. They talk about the pilot program, right? Which would include 14 health facilities, 11 primary care health centers, and 3 hospitals located in the corridor between Ochi in the north and Lioneltown in the south. Right? So that is the support that PAHO is giving to Jamaica and its healthcare system. Now you hear me just call out a number in figure and how much they're going to spend over 5 years. Now, do we understand the amount of money that has to be pumped into Jamaica's healthcare system? And a little bit of money. And this is why in a country like Jamaica, we cannot afford corruption. We can't afford thieving. We can't afford nepotism and cronyism because the people's resources very important. So what these different government, your healthcare is gonna be as good or as bad as what these different governments, when they are in power, are spending on healthcare, right? Now let me see what you guys are saying in the comment, and then I will get back to giving you more information. Hold on. Pen is no digital system. That's good. That's good to know. Yeah. Hold on, guys. So, the current health minister, Christopher Tufton. Me go tell you know how me feel about Tufton as the country's health minister. And I don't know if you agree with me or if you not gonna agree with me, but me go tell you know how my assessment about Tufton is. Now, granted, during the pandemic, I think, in my honest opinion, I think during the pandemic, Tufton, he never do too bad, Him never do too bad in managing the pandemic. Yes, it's the truth. But do I think that Tufton is a good health minister overall before the COVID pandemic and after? I don't think so, and I have to tell you the truth. The reason being, when you look at what Tufton has done, one of the biggest waste in spending in Jamaica's healthcare system was this Jamaica Move thing here, right? When you hear all of the issues, them and all of the aspects of healthcare that we need to fix in Jamaica. And while preventative care is important, there's a time and a place for everything. And with the resources that we have in Jamaica, you have to prioritize how you want to spend our money, the taxpayers' money. So when you're going to spend how much in billions of dollars with market me and them something there, you cannot do that. If you spend any money, first and foremost, how much did Jamaica? I want whole heap a million, whole heap. Jamaica Move cost whole heap of millions and billions of money. I don't have the exact figure, but anybody who had been following the politics and so forth, them know. Maybe somebody can tell you the exact figure in the comments. But it's one of the biggest waste in spending. You get a bunch of people come together, exercising, putting on Jamaica Move t-shirt, with all the hospitals that we need to upgrade and build in Jamaica. That was not a good decision, right? And I think I have always been of the opinion that you want your health minister to either be somebody who is a physician or somebody who has some experience with healthcare, right? And not just any physician either. Me I talk about physician with sense, physician with integrity, and physician who we can trust. Me not talk about people like a Dayton Campbell and Alfred Dawes and them people. Me not talk about them there. Because you see the lady who used to come out come do the press conference them during COVID time with Tufton. That lady they look like she don't make a good health minister. She's already in the system working, and she sounded very smart and knowledgeable to me, right? But Tufton, I don't know what Tufton has a PhD in. I don't know what he has a PhD in, but you want people to lead the health ministry we have some, whether you're a dentist, whether you're some kind of general medical doctor, somebody who public health, somebody who has some knowledge and understand the importance of how you prioritize and what you spend on in our healthcare system, right? I have nothing personal against Tufton. I'm sure he's a nice guy. But the truth, in my view, is for as long as he's been there, I don't think he did a good job as the health minister trying to, make comprehensive health care better in Jamaica than it was. And you have the hospital that is supposed to should have been done by now, completed by now. The hospital down at Mobile there, so where me not really see much though. You understand? And a government is supposed to can show something when it comes down to pumping taxpayer money into healthcare. And to be honest with you, we might have seen more things in a when Jamaica Move with tough than that anything else. So when I mean that is so juvenile to me. You're gonna get a bunch of people and say, "Hey, come, make we go do a 5K jog because we want to prevent this and we want to prevent that." When you bring people out there go jog in a Jamaica Moves, right? You have people who are gonna come down with all sort of diseases anyway because it's genetic for them, right? And you have some people who may can delay certain aspects of their illness, sorry, certain aspects of an illness that they may come down with because it's hereditary. If they do other preventative measures, and exercise not gonna work for everybody. You understand? And we're supposed to look on the bigger picture. We want many more community clinics. We want to upgrade and look at, the healthcare systems in other countries that are thriving and doing well, and seeing what we are doing wrong or how we can make things better. But you have to have people who have respect for taxpayer money and people who understand the thing, right? So, what the previous administration spent on healthcare versus what the current administration spent on healthcare, you know, it's kind of really hard to tell because the status of our healthcare system, it hasn't really changed much. I mean, when you see people come down with first degree burns and them a fly them go Atlanta, Georgia to go to Emory, we don't even have a burn unit where we don't have to be flying our people away to get treated, you know? So we have a lot of work to do where our healthcare is concerned. But to be fair, and in the same breath, when we look at the statistic and the data in comparison with other countries, let me get this off the screen so I can show all who just a come. Guys, make sure someone give the live a thumbs up and invite your friends over here. Let me get this off the screen so that you guys can see what I'm talking about. Right, so with everything that I just said, when you really look at the statistic where you see where countries are ranking in the world, right, for healthcare, you see Singapore the number one, Japan number two, and so on. And then when you look at Jamaica, at 67, you look at the United States at 69, you know, they may have different struggles, but Jamaica are really too bad compared to, countries like the United States, right? Let me see if I can see where countries like Canada. Yes, so when you look on this now, Singapore come like say them a lead the world in everything. Like seriously. You come down here, so 17, you see Italy, France is 20, Denmark 16, Netherlands is up there, close to the top 10, Switzerland, Sweden. Those countries are gonna be okay, as far as I know. And as you come down to Turkey at 63, Trinidad and Tobago 64, and as I said, Jamaica 67, and the United States 69, Mexico 71. Yeah? So they may have different struggles, different challenges, right? But as I just said to you guys, the United States spend a whole heap of money on their healthcare, They do. So, and I like say with our healthcare system, we have to look at spending as the only solution or how much we spend. There are other aspects to it as well in terms of performance, right? And as you can see, where we talked about access to care, administrative efficiency, equity, and healthcare outcomes. Where I read to you guys about the clinic in a St. Anne, where people are out there, people with chronic illnesses like diabetes. They out there on their foot from morning till night. And are only two doctor alone, them say. Certain days of the week are one doctor. We can't work with that. These are all part of why we are where we are. You know, them need staffing, them need proper staffing. And I have heard from people, that, staffing is a problem. Them talk about say bed space is up. Well, yes, because we're still mostly operating on the system that we started out with decades ago. We have a bigger population now. Do we all we are eat now as human beings are eat less organic? Even though Jamaica compared to many countries in the world, Jamaica people them eat pretty healthy compared to most other places in the world, right? But we have to make sure that we are expanding healthcare and that we are making it accommodating for the challenges of the time and what we're dealing with now. We cannot keep operating on a system that we had, decades ago and keep on a patch it up on them something. No, right? I want to talk about even mental health. We need to also expand our mental health facilities and stuff like that. Let me see what you guys are saying in the comments here. Okay, thank you for that information. So he has a doctorate in business administration. Okay. Yeah, a person with a business administration background. Me not say them not good for nothing, not good for something, guys. That's not what I'm saying. I'm saying when you are dealing with healthcare, is that it's like speaking a different language. You have to know every aspect of it for really understand and can manage it. So thank you for that information. We're talking about tough time, guys. They upgraded many health facilities and even reopened some that were closed. The truth is, for decades, these institutions were run down and a lot of money was spent to fix them. Um, Sometimes when some people type in at the comment, may have to be careful because, and that's just the honest truth. And I'm not dismissing what Josiah is saying. On this channel, you have people from both sides over here and people from no side. You have PNP side, JLP side, and no side. And sometimes JLP people them, they will come talk favorable in the comments. And you have PNP people that will come cuss or whatever. But I ask that you guys, if you're going to participate in the conversation, don't come with tribalism, come with the truth. Because it's about our country first. Politicians are going to be okay, They're going to always be okay. But when it comes down to our people, we must make sure that the truth is spoken, right? No, I don't have any proof and any evidence that a lot of places were upgraded and reopened and all them something there. And me with up on social media almost all the time. If the government is not showing that, then what are we supposed to say? We don't have nobody that come out and say, boy, the healthcare system is great. Because this comment that you just left here, Morella, it would make it sound like it's great. And we know that's not true. Right? Now the other part of your comment will say, for decades the institutions. Yes, that is absolutely true. Right? One of the biggest projects that the government said that they would do is the Hospital Cornwall Regional. Is that completed? Please tell us if that is completed. That is one of the major projects, right? So, I mean, I'm not being dismissive of you, but let's just try to be truthful. And if you have any information, you know, that can be helpful to us, don't be afraid to share it with us. Right? Because you're saying that many health centers, which many health centers? If you ever come and talk, so be specific, so we know where to go look. Many are reopen. Be specific and let us know. I have family member who working at the healthcare system of Jamaica, you know. Yeah. Right now, my family member, she's a nurse and she's in a different country in the region working right now. Been a nurse a long time, right? So we're not putting a blame still. We not put the total blame on this government because what where we are today is a build up over different governments, right? So nobody feel like say may I put 100% blame on the government. I'm not doing that. However, when the health minister and them come and say them have big project, healthcare project, and when they don't fulfill that, what you want us to say, we have to keep it real and keep it truthful and ask them about accountability, right? May I go open up the phone line shortly? We can talk more about it. I joined the health center in St. Anne. I'm proud of the care that I got. I got all my medication. I also got my NHF card and also my appointment card. That's good, Hope. That's good. We don't want to hear say the all of the healthcare facilities they mash down, run down, and pop down. We don't want to hear that. We want it to be great, just like Singapore, right? But there are some shortfalls, and we have to acknowledge them. Jamaicans need to exercise and eat healthier. That was what Jamaica Moves was about. We can't just be building hospitals for people who refuse to change their lifestyle until they are ill for life. Look here, Jamaica Moves was a good thing. We're not saying that it was all bad, right? But what we are talking about, and Jamaican people, they also have to take responsibility for their own health, right? Those who smoke, those who name some whole heap of junk food and then now move and now exercise, them have to take responsibility for them health. The issue is when Tufton is going to take on that role, while there are so many other people, millions of people, right, who and not because of exercise why them are gonna get sick. You need to have a healthcare system that serves everybody. Okay? So to try and justify, and you're probably a labor right you know, come know some honesty. Uno know why you say the healthcare system need fixing. Uno want come here. Don't do that. Don't do that. Cause me know no. Me know no style and uno not going come here, come try and distort the truth. Jamaica moves, it was a good thing, but it's not the government's responsibility to draw out people from out of their house to come exercise. Because some of them might come out, they can exercise to put on the shirt or if come in the limelight. But when they go there, yeah, they not eat good and they not exercise. What is Tufton gonna do about that? Right? We need health facilities. We need good, nice, clean health facilities to serve everybody, including those who are going to refuse to eat good and refuse to exercise and a drink heap of rum and boom and a smoke the whole heap of grabber and them sitting there. The health minister is supposed to make sure that we have good facilities. That is very important. And a film duty to get Jamaica for exercise. Then can put commercial on TV. Encourage people. Yeah, them can use JIS for put out information right there. So to encourage people to eat well and so. But the heap of money and millions of taxpayer dollar where then take for go do market me and them something there. That not right. That is not right. Singapore has low corruption. Yes, they do. I mean, hear one man talk say, oh, they fix corruption over there. They say, then don't make a big fish them get away. Then prosecute them. So when the small fish see that, them not go even think twice. And that's a very good strategy. Lifestyle diseases are burdening the healthcare system. So Jamaica Moves was a way to get people healthier and reduce hospital stay and care. So what we cannot talk about the crime we are burden down the healthcare system. You know think the crime burden down the healthcare system too? Especially the Kingston Public Hospital. Where they smack in the middle of where the whole heap of gunshot them a fire. You know think that burden down the healthcare system too? One of the biggest burden for healthcare in Jamaica is crime. If you never know, let me tell you. You don't know the people got hospital already and then can't get through down there because what? The people gunshot. Look here. Do me I beg you. Are the same person. Do me I beg you. No come over here contact no foolishness. Do nobody come over here contact no foolishness. We all know about exercising. We know from where I go to school, them tell you come out of the house, go to the door, run up and down. We know that already. We know that. But the truth of the matter is, you are going to have people who get sick and get ill because they are predisposed to it, meaning say it's a genetic thing for them. You have other people with them that no lifestyle cause them problem. So una have this idea that every illness and every disease has to do with lifestyle. No. And this is why we have to have people in the healthcare ministry, in the health ministry, who understand those things and can explain to the people. It's not just lifestyle. And it look like you just come on the live because, I just read to you that there are other things. There are several other diseases, four of them, that are non-communicable chronic illnesses. Them no must have been caused by things where you do or where you never do. So let us talk with sense. We are promoting sense talking over here, so no foolishness. If you're not knowledgeable about one topic, listen and ask question. Jamaica move was doing good maybe for you. But what about the people them? What about the people them will stand up out a door for hours and hours and hours because a doctor never out there to serve them on a Wednesday? A one doctor there. Eh? Jamaica moves help that? Me no business we carry come on when nobody else a do. We have a style when we have a problem. We like to use other people and what them a do. To compare it to ourselves. That is not the right approach. You look at what you have and you deal with it accordingly. Right? So meantime, when they are Kingston I run up and down about Jamaica move. See some people here down one hospital or one clinic where one day a week the doctor them come look about them diabetes. And see where them sit down out here so. So don't fixate on Jamaica moves. You hear? Because there's a lot more to healthcare. There's a lot more to illnesses than what una come talk about Jamaica move. Talk with sense. And if una do not understand, listen and ask questions. Then look here, you say I talk about what's in the news. What is in the news? When you read something on news, sometimes you know question things and go look about it for yourself. Eh? That is not how you absorb news. If you see something, you go look it up for yourself. You know always. And first of all, these people in Jamaica we call themselves journalists. You know, there was a time when you had journalists who only reported, let's say, on healthcare. You see, those journalists, they go out into the field every day and then go do their own investigation. And you see them out there in the field. You know, see them as journalists that operate like that today? Eh? Most of them only a report where they either get paid for report or they report in a one way where they don't want to offend anybody. You see when they come announce the people win election and you see what happen? Yeah, me don't want a tribalist over here. Everybody welcome, but no tribalism. The government has and is currently renovating, expanding, or reopening healthcare centers, i.e., the what you meant to say? Chapelton Health Center, Browns Hall Healthcare Center. It is not 100% great. Me not care where the labor right them want come over your contact say. It is not 100% great, and this is why I decided to do this program tonight. You know, I have a whole heap of pictures and videos in my phone right now. And when I was doing the presentation for tonight, I hesitated about sharing them. And I'm talking about some of the hospitals in Jamaica where people lay down on floor and all them things there. And I say I'm a Jamaican, I'm not gonna come out here and make the thing look drastic. So somehow of the easy on self attack right here. So yeah. Una talk about some of the little things them on the ear reported and them something, but we're not talking about the reality. That is reality. And I could have brought those videos out here. And none of you couldn't talk if you don't see it. So me don't want no tribalism over here. And anybody me say I behave tribal, me I could block on half a year. Now, let me open up the phone lines a little bit. Hold on there. Because I don't use to Android. Yes. I want to put the phone number here, so. See the phone number there. For anybody who want to call. For anybody who want to call, see the phone number there, 478-772-7976. And I guess you could call straight if you're in the United States, but WhatsApp is the preferred line of communication. How it is? Okay. Hello, good night.
Yeah. Good night.
Good night, darling. How are you?
Hello. I'm not bad.
Thank you for calling. Your first call over here.
Yeah, you know what one time? Anyway, let us talk on it else here a little bit since I was a part of it.
Okay.
As you have said before, it's accumulated over a period of time, right?
Talk up a little louder.
As I was saying,
Better.
it's accumulated over a period of time, and as you said before, the system wasn't from longer time, so it's not built for this volume of people nowadays. But let me assure you on some of the things that I know are factual. One, they're upgrading the system now to be digital. The first clinic was Mapen Hospital. They're the first one. There are clinics that are available. Let me say some issues. What I would want from them to do, to have some 24 hours clinic available within a pharmacy to take the pressure off KPH. I'm talking about like in the Kingston area. To take the pressure off it, and I'm going to tell you why. I've been there. Certain things happened to me, and I went there. And when I went, it was a case that I could have dealt with at the clinic. But we couldn't go to the clinic because there was no clinic open in the night at that hours at the night. I'm not going to say the system is not bad, but some of the videos that people I see some videos too. Not I don't know if they're the one that you have, but I see some videos that are from COVID. And everybody know that COVID was a bad situation. People are about.
No, we're not gonna use the COVID video them and judge it, because to be honest with you, COVID was a very different time, and we are gonna expect to see some things like that. So it's not the COVID videos I'm talking about.
No, I'm saying I've seen some videos that are from COVID where people are saying it's no. That's the point. I've seen it elsewhere, so I'm not sure if that's what you have. I've seen one about Mapen Hospital where they say it's Mapen Hospital, and I know it's not Mapen Hospital because there's no part in Mapen Hospital that's like that. Right? As I said, there are some things that are open. You have Chopperton is reopened. You have some are upgraded. Let me address something about the doctors now with the waiting period of time. I heard people complain and calling and complain that they go there from 4 o'clock in the morning. Let me tell you how they operate at the clinic. You come, you might feeling sick, and you get up and say, all right, I'm going to hurry down at the clinic, see if I can tell the doctor and get through. They have this thing what they call an assessment. You go to the assessment area, the doctor will assess you and say, okay, all right, your case is not really that important, not really important, that is an emergency. So you can come back the following day. And if the one is sound serious enough for them to see, they will send that person to registered. However, in the system, they also have people where they have appointments. Now, you might get up 4 o'clock out of your bed, and I may get up 8 o'clock because I have an appointment. You go for an assessment. The people who have an appointment, those are the ones that the doctors see first, even though you reach your 4 o'clock. That's how the system is set. And I want to give a big shout out to Harborview Healthcare because it was a very chaotic when I just used to attend it. And then now you have Dr. Broad. I don't know if she's still there now, but she organized it in a way that when you reach by 1 o'clock, empty, everybody out. So I guess one other thing is that organization is one of the things when we come to the healthcare. Another thing about it too, some people need to use the healthcare more than how they use the hospital, depends on how they are feeling. Another good healthcare again is Windward Road. Most people don't use it. They go to Cape Breton, and I'm in Kingston now, so I will speak mostly of Kingston, but I've been like living in Clarendon before, and I've admitted in Cape Breton before too, where I had to sit and bench before 2016.
So look here.
Yeah, and it's like I have to sit in there. I remember a time there where nobody couldn't get in the bed. There was only one bed there, and it was reserved from a patient that was coming all the way from Lanington Hospital, and it was before 2016. Now, let me run quickly to the hospital. Apart from the one that they're going to build, the new one that they're going to start building, I think this year to early next year. Cornwall is a case of where, this look like just the roof or move. So you start move off the roof, or when you look on the roof, you say, Jesus, please. I say, body, and then you move up more. And when you move up more, there's another issue. Plus with that now, they're adding on a 6-story, another 6 extra story of wards on it. So they run into problem. They do run into problem that you did not expect, and that's why people will think, it's wasting of money in a sense. It's their teeth in the money. But when you plan out a budget, and when you start a budget and things comes in, it costs the budget to go up, and people does not understand that. And also beside it, there's another adolescent. That's from baby stage, from before you're born or whatever. I think they should have put an next jubilee something in that too. That's my opinion. Right up to the age of 18,
pediatric.
Will take off some of the load.
That's a pediatric hospital.
Right, but I think they should have put something on it, like they should have had some more for people to have babies there. Anyway, but I guess that will take some of the load off of Cornwall. That hospital, right? It will take some of the load off Cornwall. But I know there are hospitals that have been upgraded, and I know they are thing. And another thing too, it has been posted on the Minister of Health and Wellness website. It's been posted on the minister, that's Christopher Tufton, page and status, but Jamaican people.
So which
foreign people there.
So which party you affiliated with? Talk the truth. Uno can't come over here to trick me, you know.
Alright. I'm gonna be frank. I like Andrew as a human being, and I think
you are a Labourite. Me not run you, God no.
No. Listen, I like Andrew as a human being. I is a human being. Somebody that I've seen even before he become prime minister. I'm not young, I'm old. Even before he become prime minister.
Okay.
On the other hand, I do have a nephew that's a MP.
Okay.
MP.
Okay.
But I don't have a vote. I literally don't have a vote.
All right. So let me ask.
You understand me?
So let me ask you a question before somebody else come in on the call. The Cornwall Regional Hospital where them start renovate from 19 how long? And I don't mean that
It started
literally.
from PMP time.
I don't mean
It
that.
started from PMP time, Tim.
I don't mean.
It started from PMP time.
Look here.
Yeah. Go ahead.
Hold on there. Guys, when you hear the phone free up, then you can call. Because you not going to get me if me talk to somebody already, okay? So, the Cornwall Regional Hospital, make we not talk about PNP right now. Make we talk about the government of the day. The Cornwall Regional Hospital, where them said that them was going to renovate and fix. Them did it 2016, 17, 18, 19, 20, how much years now? You think say it's right fit still a fix, my friend?
Well, all right. My information, right, is that they go in, which the idea that was given that they should have find somewhere else to build another one. They choose to go in and create something there, right? So when they go in to create something there, where they want to call a thing a zombie house, and you take it and fix it up and renewing it back, and when they go in it, there are problems that had it where they did not expected it, right? Then COVID coming, that was put on hold. So I don't honestly, I don't know how to assess this. I will just probably tell you what I know.
Okay.
That are facts.
All right.
And then you can make an assessment.
Yeah.
They're going to do it, and when they're going to do it, they're running a problem because they never expect to say, oh, it was this bad, that errors was that bad. And then now COVID come, kind of slowed down certain things. Now they decided to add on more wards on it.
Okay.
So them say it will be finished must be between the 24 to 25 physical years. I guess maybe if you not finish by the end of this year, we'll finish by next year. So we will see then.
Yeah, because
as you know, you can start a project. Problem we never bargained for, never expected, comes in it, right?
Well,
and if they added on more words, then it's a problem.
Well, the way how
take a little bit longer.
The way how they would normally do something like that. Hold on, the way that they would normally do something like that, they let the people them come in and do the assessment. If them say them want to renovate the entire hospital or just one part of it, where them are gonna find a problem and say the problem bigger, then we don't need somebody for come survey the whole thing. And then somebody can say, all right, wait, hold on, you know. The person can say, all right, you can either fix this or just demolish the whole thing, and stuff like that. I mean, it sounds poorly planned to me, and to be honest with you, since 2016 when they came into power, COVID came 2020. What really was the plan? And you cannot be moving project to project and finish the first project yet.
Well, they came in 2016. Remember, they didn't exactly started exactly 2016. Right?
No, I know that, but me actually say.
All right, so I'm saying they did an assessment, So when they did the assessment, they decided, okay, you don't need to knock it down. We can go ahead and we can do that. In the process of it, they realized that, there's more damage to this, so guess what? We have to go do something else. As I said, curve it around and fix it around and make it be on par to where they want it to be. Right? So they encounter a lot of that. But because most people are not taking stock of them when they're talking, not taking stock of them when they post certain things, people will not know. You just hear, they will only see the report of when he said, okay, it's not open yet and it's needed another $100 million added on, but people do not see the pattern. That's the thing with them too. They don't put out the pictures because there's a CT scan that came down for KPH.
Okay.
And there's an X-ray machine that came out for KPH. And only if you know, because me follow them and see it. The CT scan is not fixed as it because it come down in parts, so it has to fit up.
Okay.
And the X-ray machine, the guy was telling us how we do and how much slide it can take and stuff like that. Now, St. Joseph Hospital, it's a mini hospital. It's I don't know. I think they said they're trying to do something to it. I'm not sure of what they are trying to do to it. But I think that's an hospital that maybe they could, because I've been over there, that's an hospital that they could use and transform it into a burn center. You people of Jamaica, you don't charge them. Anybody from overseas, you charge them. You can do what you call that something there, maintain it. Yeah, that's something they can do for a burn center, St. Joseph Hospital.
There are a lot of possibilities.
Road.
Yes.
Yes, it's an hospital that's on the dinner road. So I mean that's something that they could have used. I mean, if you know there, you know, it's a big place, so they can use it. Because it used to be a private hospital. I think it was a private hospital, but I remember the Prime Minister said they take it over.
Okay.
So I guess I'm gonna get some information on that, like how me can send a voice message to your phone, and tell you if they have taken it over or what's the issue. But I mean, they have health center, but most people, and the problem is to, and as a person, as you said about the people and that have an appointment that the doctor come once, the appointments that you get, so maybe it's not really the doctor come once a month. I say I'm a diabetic, right? And I get my appointment, and when they do, you test you whatever the case may be. Okay, your next appointment in 4 months' time. And when you go back, there's 400 people appointment that is on that day to you. And that's why I said I will always pick up our review because they limit their intake of appointments for each day. That in other sense, so in probably when they look and they say, oh, the day they full up, and then they move the book and they look and say, okay, all right, less people there, so I will put you there, so.
Okay.
Right, so that's something that people should not blame any government, either JLP or PNP, on it, because you can't expect to get up out of your bed and say, all right, we're going to clinic. Clinic open 8:30, which in clinic actually open 8:30, and then they do the assessment. The doctors come in 9 o'clock. That's when the doctors come in 9 o'clock, right? And then when the doctors come in, you're gonna say, oh, but you left your house, to go to a doctor, and you left ready to look for a doctor and go work. It does not work like that, and we as people must be fair.
No, look here now. We have people. Well, first of all, thank you for your call. Let me just explain what my view is on what you just said, and I'm gonna take some more calls. But thank you for your contribution here.
Yeah, man.
Thank you for calling. Yeah, man.
I mean, if you don't know to.
Yeah, man. I'm gonna open the WhatsApp group, and so you guys can also continue the conversations in there and share what you know is happening.
Yes.
Yeah. Thank you for calling.
Yes. Yes. I'll go back and live.
Yeah. Yeah, guys. So when it comes down to administrations and governments, we elect these people to do a job. When they are not doing the job, yes, they have to take some responsibility. Yeah. Whether them are JLP or PNP, when them come and them not doing the work that they were elected and appointed to do, yes, they have to take responsibility. The other thing is, with the Cornwall Regional, if you say you're going to renovate one hospital, you're not going to just patch it up, Or you're not going to just fix the roof. You say you're going to do a full renovation on the hospital. You're bringing the people them to do the survey so them can tell you how the renovation process supposed to go, how you can move patients from here to there to start the renovation over here, over there. Or they can say to you, this place is so dilapidated, just start building a new hospital. So the argument that when them start fix, them realize there are more and more and more and more problem, it's just not adding up to me, because I know that when you set out to do a full scale renovation like that, you have to get people to do a pre-assessment on the project, and they will tell you what you need to do. That way you don't start it and you're running a one bag of problem and have to stop. They would have see that in advance because they know what to do. So if you get the proper assessment, then it will make sense, right? But in my view, if you cannot complete a project like that, then you are I don't know where I tell the people them say, but in my view, when you complete something like that, then yeah, me will give you a whole heap of flowers, right? The little thing they want to say I do, that's all fine and good, but much more needs to be done. And as me say, I stand by the fact that I don't think that tough that me not have nothing personal against the man, but me just attack the truth. He's been there a while now. He's been there a while. You understand? I still feel like so we need much more clinics, as what you just say. I know everybody for run go hospital and everything require hospital visit, but sometimes people don't really understand the illnesses and things them. Them will run go the hospital and realize there's something where they can get taken care of at a clinic. But if the people in a clinic nearby, what them are gonna do? Them are gonna go hospital. And we don't have a lot of clinics like we used to. So that is a problem, right? And the video them when me talk about what me have, when me decide not to share out here, them they have video after the COVID thing. Me see the video them from COVID already. But in most recent times, spaces in the hospital seem to be a problem because clearly we have a big population, right? So we're gonna need more space in the hospital them. And that's just the truth. So when my friend here called just now and me ask her which political affiliation, you should laugh out loud. Nobody can come over here so come trick me. And when me come out here and me talk the truth, cause me don't come out here and talk without researching guys. Me make sure say me get my research and my information properly. So nobody now will come over here and make it seem like say nobody over here. So Dilulu, right? The government, them have a PR team. So if the government do something major, or did I do something major, they're supposed to put out them something so that people can see. Otherwise, fire the person who are the PR somebody. You see? When you doing a healthcare, you say a healthcare minister, come out and show in one and two equipment. That are not really nothing. That is not really much. And I just the truth. So me no know my expectation is different from a lot of people's expectation. Like me no do mediocre. I saw me stay. And that is one of the reasons why I know everybody me can support. Well, and make us make can answer this. Good night. Thank you for calling.
Good night, Natalie.
Welcome to Jamaica Politics Uncovered.
Yes, thank you for having me.
You're
So
welcome.
you guys, the lady before spoke about healthcare, but you know what I think is really needed, Natalie, is an emergency response system, meaning that I remember a situation where this little girl died because she had asthma. It was late in the night,
Yeah.
and she went to the hospital, and there was no asthma pump, there was no defibrillator, there was no the thing that they use at the asthma. The doctor said that they couldn't. There was nobody there. I mean, a 16-year-old girl that is very promising. Her mother's one child died because asthma. You should not be dying from asthma. People should not be dying from asthma.
That is true.
In this day and age.
Yes. Emergency.
So I feel like say, yes, I feel like say if there was an emergency response system where we can just she would need to go to the hospital. They would get her stabilized and then she go, because what happened is that her mother said that they were asking, can you just give her some ear? Can you give her some ear? Can you? No, there was nobody there. Her mother basically died there, and she was not stable enough to even move to another hospital. And that is sad.
Which part?
A 16-year-old promising person. This happened, I think, maybe 2 years ago.
Which part of Jamaica this happened? Which community?
No, this is it happened at UA.
Oh, at UA. Somebody said they're not hearing you clearly. Can you speak up, please?
Oh, sorry.
That's okay. Yeah.
Are you able to hear me now?
Yeah, man, better.
Yes, so I'm saying, yeah, this happened at UA because I think she lived like in the near in that community, but she used to go to, her mother said she had been going to kiddies clinic from she was 3. But because when the asthma took her so bad, the kiddies clinic was closed. She was like, okay, the nearest hospital would have been UA.
Oh.
When she went up there, there was no bed or anything. All the things that you're supposed to do to get here to stabilize yourself and then carry her to somewhere else.
Oxygen.
Basically,
yeah.
They weren't able to do that. And I'm saying this woman lost her one child because of that. So I'm saying though, if we have an emergency response system like how they have it, whereas if somebody, can't breathe, you just give them some oxygen, stabilize them, then it can be done. I think that is why the hospitals and those things are overrun, because a lot of people go there for small things.
Yes.
And then it's just so we need that emergency response. Whereas if something happens, you have to hope that somebody is gonna be gracious enough to give you the car. Like I've seen it on the news, it's heartbreaking to see when an accident happens and we have people are fan down people. Give me a drive. No. You're basically waiting on the generosity of others to bring you to a hospital. No, it shouldn't be.
Not true.
It should be. So I feel like those things will offset people having not to go to the hospitals. People having not to go, those things can be taken care of. So, okay, we stabilize these people, then that. And even I saw the other day, I think I saw a video of a nurse. She was in the ambulance. And I'm like, no, nurses shouldn't be in ambulance. Naturally, we have bright people in Jamaica. Jamaican people don't. We can't train them.
I think everybody should be. I think everybody should be trained in basic CPR. To be honest with you.
Yes, basic emergency somewhere else. I remember one time this guy, I think something wrong with his finger and he was losing blood. Finger. Like a finger not off somebody like that. This day age?
No, I agree, because
the hospitals are overrun, the clinics are overrun, but we need another thing in front of that.
So look here. If you would, are you in Jamaica?
Not in Jamaica, but when I was there.
All right, so you could pick up your phone and call one phone number where it's just for emergency, like you get sick, your grandma is not breathing properly. Have not like, cause them have ambulance like in upscale communities in Jamaica where you can call for emergency care.
Well, as in when I lived in Jamaica, I was living off Trafalgar, so there was just this Dr. Adrian something. He had his private ambulance thing where you could just go there.
Okay.
But because I lived there, I could just probably walk. But you don't have that emergency number. When you call the numbers, Natalie, it's just a police station, and if they do answer. I remember one time coming from the airport and somebody drove into the ditch. And all I had to do was call the police and say, oh, they were telling me to stop, but I'm not going to stop late at night. So I said, okay, I still feel like I need to help. So I called the police and I'm on the Harborview side of the Palisades, whatever. I just saw a car, just drove off into the ditch. Can you come or whatever? I'm not sure if they came or not because it was so dark on that street and I was so scared, but I was still scared for the person, but I wasn't sure who the person was. So I wasn't as a woman. You get what I'm saying?
No, you have to be careful.
They want to help, but you still have to be smart. I'm saying if there was an emergency system now, somebody could have come to him, figure out if he's trying to do somebody something or if he really was in danger. Those are the things that I think about that is like an overhaul then. So it's not just, hospital, this and that. We have to think about the first step. Remember, say you have to start walk before you can.
Yes.
You have to start before you can walk or running.
And as a developing country too.
Everybody wants to run. I know. But we
Mm-hmm.
feel like it can be at a smaller scale, Natalie.
Yes, that's
Remember, so
true.
we have no something there. We can't have them small. So it's all in call center then with them have and the people them what them out. Natalie, we could have call center just for people just have a emergency something just like over here. It don't have to be nothing on a big scale. You know? Remember, so Jamaica small like Connecticut basically. So
True.
if we start with each part, you get me? I said, just train people. People that they want to work, people that they want to train. Jamaican people, we don't stick by one thing. So if we're a doctor, we know doctor, we have bakery. They have different stuff. So we Jamaicans, we are very multifaceted. And I feel like we need to rely on that.
Yes, I
We need
agree
to
with
rely
you.
on that and train them. So I feel like, say, yes, the health centers, some of them are something there, some of them, but I feel like we need to take a step further in front of that to say, okay, yes, the health center is okay and the hospital, but if somebody have an emergency, who do we call? Let us look
Yes.
at that. Let us look
Delayed
at
care
that.
is one of the causes of death too. When you have delayed care, and something like asthma, as you said, should not be killing anybody.
Should not be killing anybody. It's
Yeah.
not the heart disease. Should not be killing anybody. And people have died for less than that because I'm from Spanish Town. And this little girl, same thing, this guy's twin brother died because he couldn't breathe. He had to get not scandal bag, that brown paper bag.
Mm-hmm. Rebreathing.
And he had to
Mm-hmm.
get a brown, yes, and but because when he went to Spanish Town, no, it apparently them I say it wasn't, there were other emergency more than his. And he ended up dying right there. Young, promising man, Natalie. We're not supposed to have died
Mm-mm.
from breathing something.
Not true.
That person could have called somebody and that person then come there and give something stabilize him and then now we treat.
Mm-hmm.
You know what I'm saying? That's why the
Mm-hmm.
hospitals are so overrun.
Boy.
Because everybody are coming with everything. So everybody have this, their finger broke, them are come. No, that can be solved right at home where you have the ambulance, them come or something. Something needs to be done in terms of that. Because that will be able to know. The nurses will be able to manage because then everybody are come. Remember, so them overwhelmed too, you know. Them
Mm-hmm.
are
Not
people too, you
true.
know.
Mm-hmm.
So if you have that middle person or that person in front, you say, all right, Raji, me assess you, whatever. Natalie, me do a
Mm-hmm.
triage and say, all right, Natalie, this is something we can't treat right here, so you're not have to go away. Then that is one less person at the hospital, Natalie.
Mm-hmm.
For somebody else more serious, you know. You get what I'm saying?
Yes. And
Like
sometimes
a
they
pregnant woman. Go ahead, Natalie.
no, I was just gonna say sometimes the ambulance them equip with certain things, so they can probably treat somebody with a
Yes.
minor issue and say, you know what, tomorrow
Yes.
go and go see follow up with your doctor.
Yes. But
Mm-hmm.
at least when they go to the doctor now, the doctor can say, okay, this was done, this was done. So if
Yeah.
not, if you go over ways rather than something there,
Mm-hmm.
because
Enough people
you
dead
already
so.
was done.
Enough people
Yeah.
dead so delayed
Yeah.
care
And
take
I
long for reach a hospital and so.
Yeah, because you have to wait on the person hoping that somebody's gonna stop. I've seen a lot of videos. You know, little
Mm-hmm.
boy that got beat up in central Manchester, St. Elizabeth, one of those schools.
Yes. Oh
And
God.
you can imagine his friends had to carry him and everybody walking past. We cannot depend on the generosity of people because people are getting really evil.
Mm-hmm.
And like one time, we grew up in the 90s, early 2000s.
Mm-hmm.
And it get worse now. And the generosity not there. Nobody not care. If I feed them family, they don't care.
A true
You
man.
understand?
Yes. Yeah.
So you can't wait on that. You can't wait on that. We need to have some system in place where people not dead for foolishness.
Mm-hmm. I miss enough
Things
gun.
that can
Miss
be
a gunshot
avoided.
victim. Miss a gunshot victim of Jamaica, and a man now want put them in a car and then dead. You understand? I may grow up again.
Exactly, because people are thinking about, oh, my car is going to be dirty. People are just so vain nowadays. So I'm saying
Yes.
to avoid that, okay, I wonder if Natalie will pick me up. I'll do me get that. No, you don't want to do that. You
And
want
over
something
and
where the
over
just
here,
dispatch.
you're not gonna
Mm-hmm.
see no police that take up no gunshot victim can go hospital. But Jamaica, the police them supposed to take up the gunshot victim can them go hospital. And really ambulance supposed to do that.
Yes, that's what I'm saying.
And the police them
That's
just
what
take
I'm
them up and
saying.
fling them in the car back. No, sir.
Yeah, so that's what I'm saying. So I'm saying the health center's been upgraded or whoever they're talking about. Yes, but it's not at the level. I'm saying get in front of the health center. Emergency response people,
Mm-hmm.
emergency response technician. We have CPR, vital signs, all those basic stuff. where you can save somebody, make them stable, and they carry them to the hospital. You can't make people like that in 2024, 2023. Now, in the early 20s, over asthma and breathing, something, and finger broke. And brother, you get what I'm saying? And then
Yes.
more serious. So we feel like that is what is needed. Parliament about healthcare at hospital, let us get to the root of the problem. People need to know that there's a number that they can call when something is happening and help will come right away.
Yes, that's very,
and help that is effective. Yes. That is what I think is needed. Because a lot of these things can be avoided. We cannot wait on the generosity of others.
True.
I hope so. If me go bed, somebody go have their heart, it go pull on their heartstring and carry me. I'm not going to drive fast. The road bad already. You get what I'm saying? It's just too much drivable.
I know the rural parts of Jamaica. Can you imagine rural Jamaica? Lord Jesus.
When most of them, yes, most of them when I have car like that. So if you have a little car, you get me? I say the road bad already. You go, you can imagine you get a gunshot. You have in one of the panel road there. You see the gunshot going more and more because the road is so bad. So I feel like. Go ahead, Natalie.
You say that we need more emergency care, which I don't think anybody would disagree with. And the caller before you said that we need some more 24-hour clinic. Or if you in the States, you would know, we then call them med stops, right?
Yes.
The ones that are not
urgent care.
Urgent care. Yes. So everywhere you live now, them try to open a lot of those over the last 10 years or so. They've opened more and more of those. So I feel like let us say that you live in a one very rural part of Jamaica, right? Or you live at one place and not too much vehicle now come or whatever. If you have an emergency, there should be one local 24-hour clinic where you can go and one doctor did a pan shift through the night. You know what I say?
Yeah.
Boy,
so that they can see you. So at least can see you and you stabilize until you can see if it's something that is they're not able to treat, because remember say if they're small urgent cares, you're not gonna have the whole scale of a hospital. But something that you can be stable. So for example, a pregnant woman, Natalie, she's supposed to have baby. Suppose they say May 5th and she realizes she have the contract them week. Somebody could have come over and see what is happening and say, okay, say, we check you, you're not really dilating, it's just a contract or whatever. You have to go to hospital now, go sit down on bench hard like what, and doctor will tell her, say, oh, say, you're not really pregnant, you're not really, I'm not pregnant, you're not really deliver, but she's been trying to be careful. So me I say, if you have them clinic there and you have an emergency response where they just tackle those little issues where you don't have to go sit down in the hospital for, that would be good. Because then she don't know, say, all right, then you're just at 1 centimeter, it's just the construction, just go and bring through it, or whatever they're going to tell her. Yeah. Whatever the case, based on what they've assessed, they say, boy, say it's serious, this is what we can't handle this now, You'd have to go get better care. But at least you don't know. Versus and them could have,
and them could have been the middle person. Yes, and them can be the middle person mediating, what will happen to the patient next. Call the closest hospital, help them get check-in, call one ambulance or somebody for come carry them, go to the hospital. Yeah, man, that's true. Very important.
You can't wait on that. You can't really wait on that. We have to get the front so that a lot of people's lives can be saved, so that we're able to not overrun the hospitals with the doctors and nurses having to work with their resources. You get what I'm saying?
True.
Some big stuff, because I fell down. I went to my friend, she had a baby, and I don't know what happened, and I just dropped down right at KPH. And that was like 4 o'clock. Natalie, I didn't get bed until 2 o'clock in the morning. In 2 o'clock in the morning, when I got bed, there was no sheets. I said, oh, we borrowed that sheets. People were there doing dialysis, cancer patient. The place was so overrun.
KPH.
2 o'clock. 2 o'clock in the morning.
The population big now. The population big, and that's the thing that we have to address is we have a much bigger population. We're gonna need more facilities. Can you imagine the staff we have to deal with them? There's something there. Anyway.
Of course. But I don't want to stay long because I know other persons want to talk. Yes. I just wanted to make that would be a good idea to offset some of the burden that is on the hospital and clinic.
Yes, I know, so I might send them to the Prime Minister. Yeah, because we are Jamaicans. No, I'm going to say these points that you guys are making here, maybe I should have sent them to the Prime Minister,
Yes, I was thinking the same thing to send it to PM and Oldness, because sometimes you need somebody who all the way bright. So we don't know everything. So somebody can advise me. So we are bright people, Natalie.
For sure.
But Jamaican people are the more brightest people.
Me know them. Me not go school with them and work with them over here.
We catch things quick.
Yes.
We catch things quick. We not don't. We not slow. So we need to start use these things that we have for better. You get what I'm saying?
For sure. And stop from make. Stop from make with brilliant people. They migrate. Call them do a migrate and carry their skill go with them.
Yes, brain drain. So we train them. It's like in a relationship. You take care of the man, you take care of the woman, and then somebody just come and say, "Boops,"
and take him.
All of your work gone. All of your work gone in vain.
Wickedness. Yes. Thank you for calling.
Yes. No problem, Natalie. Have a good day.
Same
Have a good day, everyone.
Yes. Yeah, guys, the emergency care is a real problem for sure. We don't really care what your political affiliation, as long as you come honest and you not come for push the narrative. That's the only thing. No problem. Somebody say, Harriet, I saw you made 2 comments about the healthcare workers in Jamaica and how they are. And you know what? I've heard a lot of people say that, but when you work with these people in the diaspora, they're very different. You understand? The hospital where I did my clinical training, the first day that I went into that hospital, and my first patient, she was crashing. And so, everybody come in and respiratory, everybody, the emergency people, them. And you know who was leading that team? First day in clinical. You know who was leading that team in the hospital? A Jamaican. Me never really say anything still because you're not a professional setting, but I was just watching her, and watching how she was working and how she was communicating with everybody. And she was basically the lead person in charge of responding to when people are crashing in the hospital. So we are not idiot. We are not a set of fool people. But me also wonder, when people like those are migrate from out of the country, and I've come across a lot of people who migrate from Jamaica in the healthcare field, you know? And that's a whole different topic. But yeah, they might behave a certain way. It could be due to stress, could be due to training, I don't know. But when you see them work over here, they behave very different. You understand? Um Yeah, what she's saying, what the caller just said about the emergency care, very important. Me know some people were them paranoid, for travel to Jamaica, because of the lack of health, emergency service. Especially people who already have, chronic illnesses and stuff like that. You understand? Sonia, as me say, it no matter which political party you're affiliated with, whatever. But when we come biased to a point where we cannot participate in a conversation because of our biases, then that's different. Or when we try to dismiss, certain things because of it, then that's the problem. But otherwise, no problem. I haven't seen Christ Child over here tonight. Yeah, man, these are some good suggestions. And yes, when we ready to tag the Prime Minister out of social media, nobody can tell me say, don't make no suggestion and don't do this. No, me no saboteur. Me no sabotage. If me see something what is wrong and have a good suggestion, I'm gonna say it, you know. And a lot of times some people would up on my Facebook then say, the Prime Minister listen to you sometime, come we blog and talk certain things and them go do it. We don't have a problem with that. But yeah, very good observation. Um, Somebody said KPH is a trauma hospital, other institutions. Let me take this call. Hello, good night. Welcome to the platform.
Yeah, me call back again. There's another hospital, in Kingston, named Chess Hospital.
Yeah, I know where that is. What
They,
about it?
right. Um, People who have asthmatic, they don't necessarily have to go by UE. They can drop by there too.
Mm-hmm.
And another thing, they do see other patients um, just asthmatic people or people with lungs cancer. I'm gonna tell you a situation with the asthma thing done by KPH because I'm asthmatic.
Mm-hmm.
And let me tell you something. And as I said, it doesn't have anything to do with in power. Sometimes both the leaders of both the JLP, because it happened under
Mm-hmm.
the PMP, they get blamed based on the people who serve us. I'm asthmatic. We don't know reason. No, when we have a fever, we know that it's an indication that there's an infection there. What happened? I went, and when I went, they just let me. I have the fever. They give me a Panadol. Didn't send me to do a chest X-ray and send me back home. I went home, still wheezing. I had to went to the private doctor the next day before I even go indirectly into the private doctor office. The man could have hear my chest. The man said, I said, they go to an X-ray. I start a ball. And in deal with him, he deal with me and deal with me. I deal with him. I said to him, why is it when you nip me, there's no sound on my chest? And when I do it at the public hospital, there's still sound. What he said to me, there are certain things that he used that they don't use. I mean, they shortchange on the medication there. So instead of they give you 5 ingredients, they just give you the basic things to clear your airways, and that's it. So that's another issue too, and another issue where experiences too, where they said, oh, the hospitals are out of medications and stuff like that. I'm gonna put it out there in the public. Panama Canal is where they travel for the ship to carry the stuff come down there. If you get any shortage of anything in the country, be aware that the water is going down and the ship is going to come through. I'm just going to put that out there before I go to start cost nobody, because it's about the public hospital too.
Okay. Well, thank you for the
Right now, we're trying to
information.
medicate.
So where's the climate change? Where's the climate change? Make the water go down in the Panama Canal.
It make the water going down. And
Jesus.
When we ask the pharmacist, at the public pharmacist, they said it's a delay there. So I mean, what I tell you true, but the lady that talk about the hospital thing, that's what they call it, first responder. They first assess you whether to carry in, because I watched it on TV or them did in America too, and stuff like that. That is excellent, but we're gonna need the people the people who do something, the AMT them.
EMT.
Yeah. We don't think we have much in Jamaica.
We don't have what?
We don't really have much EMT in Jamaica. I think I'm a fact.
They want to train them.
But how much people, that's another thing again, we have to look on it on every angle. How much people are willing to go into that field? You know, so the other
enough
day,
people that go in there, man.
Really?
Then a must.
But I mean, let me make you aware. Although they're private ambulances still, but there are a few private places that in Kingston that have their ambulances, so you can call them in case. But as the lady suggests that in certain areas, like some place in Amokon, St. Thomas, Thompson Town, where even one place named Malvern, they need places like those.
The ambulance, the emergency service should be accessible for all Jamaicans. I agree with her.
And I don't think we have really that much of a short of clinics, but I don't think it's utilized because one, most people rather go to the hospital. In fact, most people rather go to the hospital because
No man, we not
in
have
America, you know,
no darling, a whole heap of hospital, whole heap of clinic. Me for say Jamaica need whole heap of clinic.
yeah, like in the rural areas, because they didn't have a lot there from morning, so they
No,
need a lot
no,
there in the rural
not
areas.
just in rural areas. In all communities that don't have a clinic. When time people are carry them picnic for go get immunization and all kind of things, check them blood pressure, check this, check that. That most people would rather go to a clinic. Nobody want to go sit at a hospital and wait the whole day. But then again, I just showed you guys on here that people are going to, smaller facilities and they still have to wait because they only have one doctor compound Wednesday. What can go so that you can't work with that?
Well, me can ask me say me only can brag. I can brag about 3 clinics in Kingston, right? And me can ask me can say like on Tuesdays, I know they do like diabetic, and they have special days for special things, and I think maybe that's one of the things too. And I know we invented Arborview, which I think is one of, in my opinion, one of the best clinic and organized clinic. And literally, they just have like 3 doctors there. They have
That's
the
good.
head doctor,
It's
that is
good that
Dr.
there are a
Brown.
few. It's good that there are a few that are nice, and I'm glad to hear you. Share
That
that
one
with
we have
us.
to pick up the one, they organize. I think maybe it is because they put her in charge. She organizes everything. And I can follow. Oh, she's good. When time patient go there, you hear them say to the people who after them assess you, and to hand over the docket, you hear them say, put mine in Dr. Bruno, put mine in Dr. Bruno, because to how good she is. I will always pick up that hospital.
Yes, big up
And
Dr. Brown.
Winward Road is not bad.
Yes, but
She's very good. She's
we really
well
want to
organized.
look at the healthcare system in a comprehensive way. Make sure say those who are go to Dr. Brown, every Jamaican citizen have the same access, the same quality of care. You know what I mean? In the
Yeah,
hospital.
the doctors. She is very caring and passionate with her patients.
Yes.
So even the other doctors that are there, people don't want them to look at them. They want Dr. Brown. And I mean, we need that more too in the hospital and the clinics. And
Quality
yes, we
care.
need some clinics to only me not lie.
Yes,
We
yes,
need some clinics.
definitely.
So in case we can go this somewhere, they say, okay, you have running belly, all right. So I'm Pepsi Miss Bag. Well, I'm going to sleep, all right. Okay, so I'll let you run good on a
And
KPH.
she said, "Me go
Yeah.
write them down
And
and
we need
send them to the Prime Minister." Cause she said
and we need
24-hour
you
care,
know,
24-hour care
and
with
we, yeah,
clinic with
we need it, me
no,
not lie.
not clinic with pharmacy. You have to have a 24-hour pharmacy. After.
Yes, the ones them that, and there are some that strategies is set in a geological space, right? Where say, all right, people from our view can run come a Windward Road. You understand me? People from even as far as Mountain View can run go Windward Road. People from downtown can even run go Windward Road. Yeah, I mean, areas like that. You don't have to directly be in each in constituency, but Bulby, all of you, because if you live from Bulby, you got KPH, yeah, pass Windward Road.
Yeah.
So you can stop there.
If anybody want a
me
business idea,
like that.
if anybody want a business idea in Jamaica, guys, you might want to think about opening up one 24-hour pharmacy on a year. Open up one 24
we have to
hour
go pay them. We
pharmacy.
have to go pay them, and we want the freeness.
No,
I think
no, maybe them can work with the government some way, somehow. I don't know.
true
But
too.
yeah,
True too.
yeah.
True. That's true. Yeah.
But
Yeah.
thank
They
you
do
for
it,
your call.
and the government pay them. Yeah. And another thing, and last thing I will say, I made it go. I think they should also use St. Joseph too as probably a trauma hospital, and send like gunshot business, knife business, anything like them to there. So I also free up KPH. You know, necessarily build another hospital in there.
That
any
is,
kids
yeah.
so
Well,
there that they can use that.
that may agree with you upon, because if you're going a
They can
KPH
use it as a
sometime,
trauma.
yes,
Right.
yes, because the crime pan the
All
keep
right.
on KPH too much. Yeah, thank you.
Yes, right.
Yeah,
Mm-hmm.
all right. Yeah, guys, that is a very good idea about the 24-hour, the late pharmacy. Everywhere you go supposed to have one pharmacy around 24 hour. Where I live, it's not the it's not the big city kind of situation. But right now, if me want to sit from one pharmacy, me have to drive about maybe about 5 miles. Me can't get it. Yes, and that is the only 24-hour pharmacy. But maybe if you're going to bigger cities, you can find a few 24-hour pharmacy. But since hospitals are open 24 hours, you get sent home, in the middle of the night. I have a prescription with you. You might want to fill it that night because you're in a pain, or whatever you get at the hospital wear off. You know what I say? So yeah, we definitely need to have one 24-hour clinic. KPH is a trauma hospital. Other institutions also refer patients to there. It's actually ranked highest in that category. KPH does everything. Yes, it is also a trauma hospital. Them do every God Almighty thing down there, right? And I think because of where KPH is located as well, a lot of people go there so first. Yeah. And the quality of care, it's usually good, but there needs to be, a lot more done to KPH. And all me know, me have a family member used to work as a porter down there. He died about 2019 or so. Yeah. And my grandfather used to go down a KPH every day, almost every day. Because he'd have high blood pressure, and I think that man was paranoid. Say if him pressure go up too high, he not gonna reach the hospital in time. So you know what he used to do? Get up every morning and go to hospital go check him pressure. No, sir. Um, you know what? You're from Liz? How long over there? Yeah, Jesus. One ambulance ride in Toronto is what, $50 or so? You have people who have health insurance. Some people them have health insurance, or them have government assisted programs where it may not cost that much. But there can be, little things that can be done to kind of take the burden them off the hospital. Because really and truly, guys, there are just too many burdens on the hospital we can come off for free up the thing to make them function a little better. Right? You start off one little dizzy feeling or whatever, maybe somebody can carry go run a clinic around there, so. And I'm not for staying in a hospital. So I think that's important. Um, I'm gonna call this. I'm gonna just tell some people something. You see on a program here, over here, so you got hear the opposition get criticized, and where the government for get criticized, yes, you got hear them get criticized too. So if you come here, so just for hear the opposition get criticized, just know so over here so is not working for no political party. You understand? Any criticism that come from here, so toward either the government or the opposition, it is genuine. It is genuine. I don't think we have an opposition because we know so them the people they are just so unscrupulous like a people. We know that, right? But this channel is not just for that. We have a couple things that we talk about over here. So please, if you just want to hear, one set of people get bashed, you're not on the right channel. Like seriously. Let me see if my correspondent is still awake. Um, it's the same thing. When a friend was saying a clinic in every. Yeah, man, we're supposed to have a clinic in every community. As me say, when we grew up, guys. there was a clinic in the community, and for some reason, when the shutters came down on that clinic, it was so sad for the whole community. And that was in the 90s when PJ was in power. The shutter them came down on the clinic, and everybody in the community was just so saddened by it. You understand? Because when the parents, them, the mothers, them, are carry them picnic or clinic, and it was a place where people made friends too, because mothers and mothers, them would have make friends, and them kids make friends, and stuff like that. So when the place they close, man, it come like say the community come like a one ghost town, and it was very convenient. And by the time my mother had her other child, she started to go clinic at one different place far, right? And sometimes I used to go with her. I used to see, between the Acklins, you know, when my dad was not around to take her, the Acklins on the bus and with the baby and everything at the time, hot and rary. When before that, we could have just walk go down and clinic down at the bottom of our road right there. So it didn't cost a thing. So every community it need one clinic. I wanna really expect for say, under one administration right now, even though Andrew one is in them second term, we don't expect for say every single community the clinic then restored. But eventually that is what we want to see. And that should be the plan. Your head a hurt you, you can go in a clinic around this to go check your pressure if you don't have the automatic blood pressure sitting in your yard. Without have to go into hospital. Because some people then use the hospital like a drive-through. The hospital cannot function how it's supposed to. So we are advocate over here so for more clinics across Jamaica. We can be 119 first responders with a thriving call center with a computer aided dispatch system. Now you're talking, Nella. Yeah, we need that for true. Right now, if me not feel good enough, so call 119. You know 119. Call 911. What's your emergency? Me not feel good, more want ambulance. In about 5 minutes, you hear one we want outside. And them a come right at me door come knock on it. And if they not hear me, then good I'll use one sitting licky in the door. Cause them a gonna know say me just call and they not hear me. So something wrong in here. We want some first responders at Jamaica for true. And me feel say everybody, at least one somebody in your yard to be certified in CPR. It's not a long training thing. Everybody to be supposed to be certified. You have children in our families, you have elderly people, young people. Nice if somebody drop down and nobody can help them. And that can save lives too. You can look on the statistics, CPR save a whole heap of lives, you know. Some people in Jamaica wouldn't believe you though because they think developed countries don't have these issues at hospitals. Nobody is saying that in developed countries they don't have problems. Yes, they do. And we must not always compare ourselves to other people. We have a unique set of circumstances in Jamaica. What is plaguing the system over in other countries might not be the same thing that is plaguing our system in Jamaica. So we have to look at our unique circumstances and approach it accordingly. I don't know why we do that. We always try to compare ourselves to other people. Whether we compare or compare not, my love, our problem's still gonna be there, and we have to find one way to fix it. Let me see. Oh, Christ Child just reached. Good night, Christ Child. Better late than never. Um, yeah, you have some people them paranoid. Them paranoid at the hospital system and them something there. You see, Cuba we nearby, I'm a feel so we shouldn't work close with Cuba, to get some more ideas on how we can become more medically independent, rather than fly out people and people are raise money for fly out, go there for care and a whole heap of little things, yeah. It's very clear that Jamaica and developed countries are facing the same exact problem. No, it's not the same exact problem in a digital diamond. The problems that we are facing in Jamaica, they're very unique. You understand? It's not the same problem. Because for example, earlier on I told you that the United States spend a whole heap of money for them system, but them have some problems. Now, if we get the money there as Jamaicans and spend that the money there on our system, it might fix it, it might fix it to a great degree, but then there's also internal problems in the system we must fix too, such as with organization and so on and so forth. You understand? The Jamaica Fire Brigade has EMT and the Health Ministry has EMT, just not all over Jamaica. Yeah, I imagine the fire brigade would have to have some EMT for sure. Um I think Liz probably gone at some party. Oh no no. Hey, let me tell you something. Liz always there would I go some party. She must have gone a party, me don't know. Anyway. Um yes, so I thank everybody who contributed tonight about the healthcare system in a Jamaica. Um I am glad that COVID is over because that really put a heavy, heavy burden on our hospital system. Yeah. And thank God it never to collapse the system to a degree still because even though, yes, we had, our COVID numbers, it was kind of up there, but not too bad. For a population as ours, it wasn't too bad compared to like New York City alone. And you guys all know what happened in New York. For Mandeville, we have a late night doctor and pharmacy. Think they go up to midnight and beyond. They are strategically across from Mandeville Public Hospital. That's nice. And Mandeville need renovation too. Yeah. Hi everyone. Part of the problem is that a lot of people end up in a hospital instead of attending a clinic. The health issues most of the time don't warrant a hospital visit. This causes overflow. Yes. That can be true. Your grandpa was on top of things. I'm if to tell you, the people them didn't know him on a first name basis. Every day, he go check him pressure. And he might take pressure pill. But I think he was so paranoid that something may happen and him now go reach because them time there, everybody, the younger folks, them who not gonna work, gonna school. So most of the day him did it by himself. So the man go check him pressure every day. Every day somebody say, me just see your grandfather down a clinic, down a hospital. hmm I'm a Jamaican first and foremost. Don't care about any party. I want Jamaicans to be better. I like that attitude, yes. The ambulance right here in Toronto is actually about 300 and others 250 is covered by the government if you are a permanent resident. Yes. Canada has a good healthcare system compared to some of the other developed countries. Yeah. I never really have no negative experience with the American healthcare system, guys. I mean, I've always lived in a fairly decent neighborhood or community. So most of the hospitals in America, you're gonna be treated according to where you're located, you know, and it is what it is. Um, every hospital have them look internal thing, and the hospital them they are responsible to put people in place who are good at organization and to make sure that things are always in order, right? That right there is not necessarily a government problem, right? But of course, the health minister supposed to make sure, say, all these hospitals are following protocol and stuff like that. You know what I wish to see again, guys? Me know, no, me know that all, right? Me not reach 40 yet. Me not that old. So somehow you might know this too. There was a time when you had people in journalism in a Jamaica who used to just report on the healthcare system. How did they do that? They communicated not just with the health ministry or the health minister who will tell them things from their perspective. They're going to go out there in the field. They're going to be talking to these directors of hospitals and these CEOs, and them are going to them are going to do them work. Them are going to talk to patients and people who just experience the medical system, and them are going to do them work. We not see that in a Jamaica again. So any journalist over here listen, when you go talk among on salesman and know say the people in my Jamaica were calling themselves journalists though, they now do no investigative work. Like seriously. I am from an asthma background and have children and grandchildren with it caring for. There are home remedies that can assist. Cod liver oil capsules with adults one a day. That's good to know. I agree with you. Don't be like we and ugly. Oh, Jesus Christ. But I don't know but top copy people them over here. Very biased and one sided, which no one is listening to him now. Poopa Jesus. No, we cannot be like that over here, guys. We can't be like that over here. Just like with when me see some people in the diaspora say them are gonna do one protest against the government. I used to write this, now, me can't give credence to that because if you are looking at the opposition as it is right now, and you're going protest against the government, but you're not protest by the opposition, forget some sensible people, if you can lead one real opposition in a Jamaica, then me know say some politically motivated, um, one-sided thing. So me can't deal with that. You understand? If you're a sensible person and you look at Jamaica right now, these are the worst opposition we ever seen in history. And that is attributed to the internal problems within the People's National Party. It's the truth. So we African talk the truth no matter how it come down. Okay, Nella, thank you. Thank you so much for participating. Up here is 999. Not true? 999. What, Canada for emergency care? Let's see. Where shall me live? As me say, it's not a big city, but there are one, two, three hospitals. Yes, there are three hospitals and about two urgent care. Yeah, about two urgent care facilities and three hospital. And forget an ambulance a easy thing. I who think me older than 40. Me and now never used to cross the road. Great discussion tonight. Yeah, man, thank you. Those are opposition leader. Oh, okay. Opposition leader blogger. Okay. Yes, Kimberly, good night. This are the first Saturday night vlog gonna get over here, so because I don't normally come weekend time, but because I missed Wednesday, I say I'm gonna come out here and make up this because we really did need to talk about the healthcare something here. So in conclusion, guys, we are a developing country. And we're not going to really have a whole lot of money like developed countries to spend on our healthcare. However, we can prioritize. Yes, we can prioritize and spend the right amount of money or at least close to it to make sure say we are do some things we are contribute to the development of our healthcare system. We can do creative things. You understand? Remember, say Jamaica one of the most loved countries in the world, and people donate things to it all the while. You understand? As a matter of fact, a lot of the nursing schools here in America, you see when time them a do when time them go on what you call it? Sometimes they go on clinical missions overseas. Some colleges do it, but not all colleges. Like some private colleges will do it. Maybe some public ones now too, but they'll go on these travel things. They didn't do it during COVID, but I know a couple of nursing students just before COVID who said, we went to Jamaica. Them go Jamaica upon them work experience, you know. And people do that for Jamaica because them know so we need a little help, right? And them come and do the little eye check, the little blood pressure check, whatever they do. And that's nice. So if we really set out as a country to say, all right, we're going to develop healthcare, we can raise money, we can accept donation, we can do a whole heap of things for help bolster what we're going to spend from taxpayers to the healthcare system. Nobody else no wants to see the healthcare system in a bad shape. No matter who they in a power wants it in a good shape. But the key to it is to be creative, to have the political will, and to make sure that the money is being pumped into the system. As me say, we not have the luxury for deal with corruption. Because when you do that, I'm mismanagement and not spend the people the money properly, we're never gonna get to full development in Jamaica. Never. And we don't want it to be that way. Empty promises and them something there, we can't manage that. Yeah. No, we can't bias over here. So as a matter of fact, somebody made a suggestion. I think it was through email. Where is SVG? Tell me where SVG is. Somebody made a suggestion to say if we could have bring some PNP and some JLP people and do like a panel discussion here. I don't know. What do you guys think about that? My daughter just graduated you with journalism and history, so I have to tell her pick up on what you've said, going out and talk about these things. But social media, Lord Jesus, me glad say your daughter do that. That's nice. But hopefully she won't come out and be like, cause what me see now, a lot of these people call themselves journalists. All them do is sit down in a studio every day. Me not grow come see them something there. Even up to the time when the unrest did a go on down at Tivoli with the incursion. We never see the journalists them put on soldier hat. Where you call them soldier hat there again? Helmet. And then whatever they call it. We never see the journalists them a duck and a crawl and they pan ground and pan belly a roll down at Tivoli when the gunshot them a fire. That's what you call going into the field, out into the field doing journalism work. The people them now do that again in Jamaica. All them do is sit down on social media. They now go do no investigative journalism. They not follow up on nothing anymore. And this is why you find see a lot of people them rather listen to some good vloggers than to go sit down and watch mainstream TV. They forgot they in the field. Me sound like about 35. Me not tell you no me age. Never ask a woman her age. And from my age, come on, fall me not my top count, so me don't know me how much. Me just know me don't reach 40 yet. Oh, you're there, Grenada. St. Vincent and Grenadines. Okay. All right, cool. I didn't know there was an abbreviation for it though. Yes. Oh, yeah, Liz gone her bed, Carlton. Or she up on the road. Cause Liz a road woman, but she get up early a morning time. All right. St. Anne Grenadine. Let's join the podcast, become a member. Yeah. Guys, hit the join button and become a member over here. Wanna think about the panel discussion business. Cause from where I talk politics over here. The people them are gonna come. Whether them they on one side tribally or the other, or they don't tribal or they don't affiliated, then going to come over here. So me not see nothing wrong with inviting, people from both sides to discuss a particular topic. That would be good. I don't really see a problem with that. I remember one in Spanish Town, she was working at CVM. Yes! They used to go then at the field all the while and investigate. Are the real good journalists them from back in a them time, them sure miss them. Me not listen to the one them nowadays, my love, cause them not do no investigative journalism. And some of them they sell out. People can send them money for write story and bring down people. That's all them good for. As soon start call out their name out here. Give some thought to hospital foundations work with the improve on various hospitals. This has worked well for us on the east coast of Canada. Just a thought. This program gone abroad. People from all over watching what's taking place in Jamaica politics. Thank you. When you are not a puppet, you sound very young. Oh, me sound young? Okay, thank you. I'm in agreement with the panel. We'll listen and learn. No riser. No, sir. Army, we should make the riser then come over here. They're afraid of me, no, they not go come over here. Papa Jesus. You mean a dog ears? A dog of your age is the Pope. So they out there, You are with the rise of them now. Why me don't want them over here? You see people who gonna lose election and take God off of the cross and then win. Them they're not people, they're not ready for prime time yet. Them they're not some logical thinking, logical minded people. You understand? We can't deal with I rather talk to 50, 100 labor right over here. Our people we're not affiliated with politics. Our people we have PNP, we have sense. But them the cultists them love, we kill Melissa and cover it up. Me no want them over here. They not no manners neither. Them like to personally attack people. And the people them we can't have civil discourse. Them uncivilized bad. We not promote uncivilized people. I like to talk to everybody, you know what I mean? But you have to talk to people who will bring something constructive to the discussion and to the table. And them a propagandist to a be a lie then tell. Be a lie then tell. Oh yeah. Carlton, I don't know if you see the phone number. Where they up on the screen, but we have the phone line ready, So may I open one WhatsApp group? Um, let me see. May I open one WhatsApp group? So I guess if you guys want to be a part of it, you just send a message or something. Let me see how the number there. See it here. The phone number right there, so you can use it to join the WhatsApp group. I have a sweet voice, thank you. People always say me sound serious and professional. So let's see. Yeah, man. Thank you, Charles. I would wait until the election thing pass off before having a guess. Okay. Why you say that? And maybe being in this kind of election mindset mode would be a good time too. All my friends in England and Europe watching your show, thank you so much for inviting them. I am pleased to announce that my daughter will be joining the team at Mandeville Public on Monday as a rookie RN. I have to be praying for her because Mandeville really not run good these days. Oh, that's good. I remember you saying that she had sent us some applications. That's good. Congratulations to her. I hope that all goes well. And she have to be careful because things and times change for true. There was a time when the healthcare workers, them, the nurses, them, they used to get special accommodations, guys, in a Jamaica. If Lizzie there, she don't tell you no. Mm-hmm. There was a time. So me just put the number up on the screen here. I don't have any way of contacting anybody unless it's email. So you'll have to send me a message. As I said, I'm gonna open the group tonight. And my daughter have to teach me to use a phone and come in and use Android, so me gonna make sure do it for me. Um yeah, big congratulations to your daughter. Nursing school are one of the hardest things. It takes your body, your soul, your whole being. It takes a lot of work, you know. I think I think next to medical school, going to nursing school is one of the hardest thing. God Almighty know. You don't see the number? Somebody type a number in there so make Carlton get it for me, please. Please and thanks. I put it on the screen, but then going through the comments, it kind of go over it. So anybody who have the number, just type it in the waiting to make Carlton see it. All right. Yeah, now is the right time. Yeah, man, we could have do a little panel discussion. We don't want a body where we're too biased, right? I have some people on both sides who then can talk the truth. Me like them kind of Jamaicans here. No matter what, you can talk the truth. You can invite them separately at first. PNP one night, JLP another night, then together. That no sound bad. Your call about the case. We need justice for Melissa and we will never stop say that. Yes, we need justice for Melissa for true. Wicked and evil set of people come tell me about say the woman dead in her sleep, dead from aneurysm. God Almighty. Then the police, them good all they know say nothing no go say no. For the 6 week, when the police them see the people them in the opposition I spread misinformation and lie on the woman death. I said the woman dead in her. Then if me was a police now and know the truth, but then I look on that and I said, Jesus Christ, them people are wicked, man. Me have to say something. Me have to call up Fitzbailey and say something, have one meeting with him or something. Because then could have put out one statement say, you know what? We are still investigating, but we suspect the key word, we suspect it is a homicide. They could have said that. Yes, man. But when the weight of the political party run out come talk something different, the people them good all scared. They don't want of political victimization. Yes, so you say if you live at Clarendon or work at Kingston, they provide a work, but not anymore. Yeah. Them used to have the nice air conditioner bus them. And the nurse them used to get transported on it. Those were some good times in Jamaica, guys. Where, let's see, I think I hit the wrong button. Oh, here we go. Somebody trying to call from England. Let me see. It looked like big sacrifice your daughter make me love. Big sacrifice. Please type the number in the chat. Put up back a number one more time. Hello, good night. Oh, you gotta check to see if the number right. All right then, no problem. Oh, okay, you got it. Thank you, Carlton. Thank you so much. All right, cool. Yes, I will add it to the group. Good night. Yeah. So Christ child, where you do for your daughter's graduation? Cause you know she made a big sacrifice, and yes, you might have foot the bill, my love, but our heart and our soul and our health, stress, she put her all in there, and to finish, very good. Every time I think about Melissa, it pains my heart. Then I must, man. I never see nothing so wicked in my life. Nobody talking about Donnelly. Well, the police, them have the man in custody, and I think he's gonna go on trial in April. April? I think so, yeah. And Donnelly's mom is on my page, you know. And sometimes when I saw that woman they stress out, she pour her heart out on social media. No closure. She does not know what happened to her daughter, where she went, where her remains are. No, boy, I mean, I tell us some wickedness they hurt ya. That's why I can't see it and not talk. I want me see those things, you know, guys. As a person with one child, my only, a daughter, and my daughter not a real no ragamuffin, you understand? When me see them sitting there, me have to talk out my love because, you know, right, you know? And then people are so vulnerable. So we're gonna wrap it up here, you know. I hope you guys were informed to a certain degree. Some of the information them we did want, like the spending over the administration. I would have loved to get that information, but I couldn't find it. But what I want to see how much money each administration say over the last several decades, how much them spend on healthcare in the country. That would have been some very vital information. But then again, that could have created a situation where people start throw blame. I said, this I want to spend more than that. So maybe it's a good thing we never find it. But at the end of the day, we want to see people who come with a sense of seriousness and who are look on thing in terms of long-term development and see where we need, you understand, and can provide a good healthcare system for the citizens of the country. I do not like to see when things go wrong, people are come beg money and go fund me. I say, I feel they fly, go over America for do this and do that. Then me not like see that. Me feel like say you're sick in your country, me love you must can get some good healthcare in your country. Fly past Cuba and come with America. Me not understand them. Mm-mm. Suppose they can get care no matter what, right there in your own country. And I think we have skilled people. There was a case recently of a man who, I think I want bow and arrow. Somebody let go and bow and arrow in their face. And it got through. And when they carry him, go to the surgery, it was one of the most interesting surgical procedures I've seen. And those doctors, they were able to remove it. Stuck in their face, you know. They were able to remove it without any incident, without causing any further harm. You know, these are things where all the journalists them in the country supposed to did highlight certain way. You understand, guys? So we have the people and with the skills, but they're not the people ultimately in charge, you know. You heard of the 16-year-old who got dirt in the love triangle. Yes, me see it since night. I may have to ask myself, so then the parents of this a girl I know, she's 16, my daughter 15. My daughter could outside 2 o'clock in the night with boy. You crazy? That I first thing. Now the man will come unalive she and shot the boy. Him at 38 years old and she at 16. So I guess you could say that the situation that that 16-year-old was living in, in terms of supervision. I don't know. Because nowadays I can't talk to them a teenager, But it really depends on how you grow them still. Because as a parent of a 15-year-old, my daughter never run certain joke around here, so you understand? But it really depends on how we raise our kids. I'm not saying she deserves it or anything like that, and I would never. But it's so sad that a man 38, him not no emotional intelligence can look like such the girl I deal with somebody else now and feel the right to come and hurt the girl and hurt the guy. You understand? Me see all the girl where her boyfriend born her up, the same one where did have to come over in America, come get care for the burn. Said, no, they not arrest the boy we do it. I know. Yeah, man, my dad. Yeah, man. You're crazy. I'm not run joke with my pitney, the one pitney where God bless my home with. No, sir. Yeah, the spear fishing line. When you need to look up that case there. Then fire one spear fishing line that the man face. The man that's supposed to dead. But the man got the hospital with the spear fishing line in him face. Sticking out. And the doctors them could have removed it. And no cause no further problem. I think it did hear pa I want to see it again. No remember, I don't remember. But one of the most interesting cases I've seen. Yeah, man, same to you, Gertrude. Yeah, we're gonna wrap up here now, guys. Yeah, we're gonna wrap up here now. So, like I said, if you guys want to be a part of the WhatsApp thing, you have the phone number. Just say that you do, and I'll come back tomorrow. I don't know what I want to talk about tomorrow. Tomorrow we have, not tomorrow. I'm sorry, Monday night. You won't see us tomorrow. Monday night. I did want to come and share the sabotage operation where leak where the opposition them do to their own a party to lose the 2020 election. I did want to share that with you know. All of the things them where them that go on with. I never shared pan yesterday yet, but I go share it with you know and show you. See them a people here, them is a threat to everything in a Jamaica. Yes, if I didn't do that, me not surprised when them become some election deniers. You understand? They will stop at nothing. They not care nothing. And from you see them do them style there, you know say them will come and undermine election. They not no credibility in my book. Right? So talk about skill doctor. Yeah man. They did good. Yeah. So let's see. He is now a part of a motivation program now. Okay. Boy, I'm glad him survived that cause that would have been wow. Thank God he make it out and he will always remember the medical team that helped him. Papa Jesus. That's why you have to be careful now, because people can't wicked so. Then take the fishing gun something and right in the man face. Boy, may I tell you no. You have to be careful, guys, out there. So I hope you guys enjoy the program tonight. You probably will never see me on Saturday night again. But I'll see you again on Monday of the coming week. Take care of yourselves and be careful out there. Have a good night. If you don't have the phone number, ask somebody in the comment here so we have it. And I should probably put it in the description here as well. All right. Thank you. Have a good night, guys.